A lot of indecision and maybe big scares about medical shortages in the event of a no-deal Brexit. Patients with conditions such as cancer, epilepsy and killer infections may be hit, this is the warning, as cross-channel supplies face cuts of up to 60%. I've got two doctors' opinions on this. First of all, Dr David Bull, who is a Brexit Party MEP for the North West. David, good evening to you.
A very good evening to you, Eamonn.
And not a message, David, we would want to hear. I mean, it's certainly a scary message. Do you think it's true?
No, I don't. I'm really, really angry about this headline. I think it's incredibly irresponsible, it's misleading, it's inaccurate, it's incorrect. And more importantly, it's playing politics with people's lives, which I just don't think is ever acceptable. And since I've been an MEP, I've done a huge amount of work with the pharmaceutical industry, with medical professionals, and I have data to show that this is absolutely not true.
And can we, I mean, you talk about playing politics with people's lives. You could be playing lives with the politics that you're involved in here, of course, being, a Brexit MEP.
Sure.
Do you think that negates, the credibility of what you say?
No, I don't think it does. I've known you a long time, Eamonn. I'm a doctor by training, and, I would never do anything that would harm any patient. So, look, I think it's really important to explain that the pharmaceutical industry does not rely on Europe alone. It is a global industry. It's flexible, and we actually export more medicines to Europe than we import from Europe. So it's in both parties' interest to ensure that the flow of drugs actually continues after Brexit. Our drug industry is worth £41.8 billion. But I've actually gone a lot further than this. I spoke to the European Federation of Pharmaceutical Industries and Associations, and they've assured me there are short-term workarounds, including complex things like batch testing and ensuring that the standards are mutually recognised. And actually, Europe needs us because they don't actually have enough testing sites, and the UK is very important in pharmacovigilance. But the government's also talked about the 24-hour supply lines that are in. I've spoken to all the insulin distributors. Yeah. They have already stocked 16 weeks of insulin, so there is no problem there. And in fact, I've even spoken to the NHS Confederation, which is the umbrella body of all the NHS organisations, and they've assured me there is robust planning in place. And I just think, this to me smacks of Project Fear yet again.
The thing is, if you talk about shortages, you create shortages, don't you?
Well, I mean, yeah, there are shortages of drugs currently, and that is partly due to issues with the manufacture and distribution. And also, actually, you're right, because there is this sort of indecision at the moment. I think some pharmaceutical companies are reducing supply lines because they know they can push up the price. But this is actually nothing to do with Brexit. It is just pure market economics.
Dr. David, I met a surgeon who'd finished work and come to protest outside Parliament. He is anti-Brexit, so I should, state that. Yeah. But I asked him on camera whether he could tell me whether there was any fear at his hospital around this supply of drugs and a no-deal Brexit, or indeed around Brexit. And he couldn't talk to me on camera, but off camera he said to me, listen, he said, I would advise any of your friends who have children who need EpiPens or are diabetic and need medication, I would advise them to stock up. And he was a very well-meaning, very educated doctor. And he's on the front line, and he's telling me, if you have a child who's ill, make sure they've got enough medicine.
But as you say, obviously, he has a vested interest. He's a Remainer, but he's
I don't
also
think he was out to scare me.
No, I'm sure that is true. But also, I don't believe that he's done the amount of research or talked to the trade bodies that I will have done.
Well, let's go, David. I want to bring in Dr Louise Irvine now. Dr Irvine is a member of the British Medical Association Council. You've heard what we've been saying here, Dr Irvine. What's your view?
Well, I didn't hear because my phone cut off. I'm really sorry about that. So,
shortages or no shortages, and would you advise your patients to stock up on drugs or not?
Well, we're told not to do that because it could create an even greater shortage. However, I can see there's a moral dilemma for the individual doctor and patient, because if you've got a patient in front of you that you know needs medication and would die if they didn't get it, which would be the case for situations like EpiPen, I got that bit, and insulin, then I think there's a huge moral dilemma. The fact is that we as doctors do not have confidence in the government. Well, I'm saying we as doctors, I and many other doctors, don't have confidence in the government's assurances that they're going to make sure that these medicines are provided in time.
Where does that lack of confidence come from, Louise? Okay,
so the National Audit Office report, which was only at the 20th of September, not that long ago, found that only a quarter of medicine suppliers, people who organise the supply of medicines, had found alternative routes to the Dover-Calais crossing. Only a quarter. And we know these are going to see big delays from the 31st of October if there's a no-deal Brexit, and that this disruption could continue for 3 to 6 months. Moreover, more than a quarter of medicine product lines do not even have a 6-week stockpile yet. And we wonder if they're actually going to have that stockpile. But also, you can't stockpile for much more than 6 weeks. And if there's going to be disruption for 3 to 6 months, there could be big shortages of medicines. And of course, there are medicines with a short shelf life that you can't stockpile at all.
So Dr. David Bull saying, so Dr. David Bull saying, look, it's okay. There are 16 weeks supply already of something like an EpiPen. Everything's going to be okay.
Insulin.
Okay. So you would argue actually 16 weeks, okay, but we're talking up to 6 months, and that may not be enough.
But it may not be enough, and also we have to keep people using insulin every day. We have to keep on replenishing those supplies, and if there's that level of disruption, and of course insulin also has a short shelf life, relatively speaking, it could actually affect people. Why are we taking this level of risk? The Operation Yellowhammer, which was the government's own report, said that the worst case scenario, which you had to, a reasonable worst case scenario, reasonable one, highlighted lots of risks with supply of medicines. Now, when you're in a wartime situation, of course there's going to be crises and difficulties getting hold of basic things. But this is something of our own making, as our government's making, this risk. Why, if no responsible government should be taking this level of risk with patients' health, and even though they say there's going to be mitigating things and they're going to find alternative routes, it is very worrying that only a quarter of the medicine suppliers have actually got those alternative routes already. We're only 5 weeks away, or less than 5 weeks away.
Yeah, I was just going to say those figures obviously are from a while ago. I think it is fair to say, had we left in March, that the planning was not in place. But obviously, the fact we've had an extension has given the government time to actually put in some of the plans. Can I just add into that? In terms of 24-hour supply chains, the government has said there will be special freight services, special documentation, special air services, and also I think it's worth remembering that this, and I keep saying this, that actually it is imperative for the EU to have access to UK drugs as well. And if I may say, a third of the world's medicines are now made in India, generic medicines. By 2050, half of the world's medicines will be made in India. There are short-term workarounds, there's mutual recognition of standards, and actually we have to respect the democratic vote of the people. People voted to leave.
I think you're being very glib about this. I mean, long term, there may be other solutions. In the short to medium term, 3 to 6 months, we're talking about serious potential disruption, high risk. And, I don't know if our government is all that brilliant at making plans. This National Audit Office report was only about 2 weeks ago, 20th of September, not months ago. So we're not prepared. It looks as if we're not prepared. And, I don't think we should be taking risks with patients.
Okay. Guys, I've got to leave it there. Thank you both very much indeed. You were listening to Dr Louise Irvine there. She's a South London GP. She's also a member of the BMA Council. And Dr David Bull, Brexit Party MEP, very well known on various television shows with a good media profile. David, really appreciate that. Thank you very much indeed.